Tonight, the story of a disabled resident in long-term care left with nowhere to go in the middle of this healthcare crisis. 30 days ago, he had to go to hospital, and now the city-run facility where he was staying is saying time is up and that he can't go back.
So my question was, what do I do when he's discharged from the hospital?
Sushila Lal Singh has been caring for her brother Donald as best possible for decades now. The 63-year-old has Down syndrome and has in recent years been in long-term care. She's now being told, though, that he can't go back after going to hospital for surgery a month ago.
The administrator mentioned that she would see what she could do, but she said she could not because the ministry has Section 146, which clearly states as their policy that he has to be discharged.
Westburn Manor in Etobicoke is one of 10 long-term care homes operated by the City of Toronto. According to the city's website, it provides individualized care to 192 residents. Section 146 that she's referring to comes from the province's Long-Term Care Homes Act, which states, the home must discharge a long-stay resident or a resident in the interim bed short-stay program if the resident is on a medical absence that exceeds 30 days, is on a psychiatric absence that exceeds 60 days, or the home is being closed.
Policy is not law. Policies can be changed at any time, but who can change it?
Meanwhile, long-term care homes in the province are actually being asked to take patients from hospitals to make room for the surge in people being admitted with COVID-19.
They have to look at each situation case by case.
CityNews was told that staff have provided advice and support to the family and will continue to work with the hospital and province. In a statement, the city's director of long-term care said, if the time comes for the resident to return to long-term care, home and community care, the provincial placement agency may readmit the resident as a Category 1 crisis admission, meaning they will not go to the bottom of the wait list, but will be prioritized to return to living at Westburn Manor. That said, there's still no guarantee.
It's ridiculous, and if this is what they do for people, that shows that their so-called policy of the 146, whatever it is, needs to be changed.
This afternoon, Donald's sister was told by the hospital that he's in no condition to return to the long-term care home to meet that 30-day deadline. As a result, a request has been sent to the Ministry of Health to see if he can be put at the top of the wait list.